You're clearly very angry as well. Let me read some more messages. Cham says, I support junior doctors even more since the announcement of imposition. The government is displaying worryingly arrogant and dismissive tactics. Margie says, it's not just about pay. The strike is about so much more. Yes. Ian says, junior doctors are right to strike. They shouldn't roll over to appease this evil, bullying, incompetent Conservative government. And this from Jason. I believe the junior doctors' strike still has the support of the public because we realise that without them performing at their best, the NHS would crumble on a daily basis. We know they're fighting not only for themselves, but also for the whole of the NHS. Furthermore, the junior doctors don't just have the support of the public, they have the support of the majority of the rest of the medical professions, except perhaps the trust managers. Thank you very much for coming on the programme.
Thank you so much.
Lauren Gavin. Thank you very much, John Leach and Jennifer Brown. Thanks for your time.
Thank you.
Let me bring you this news, breaking news, to do with the number of workers on 0 hours contracts. This is from the Office for National Statistics. The number of workers on 0 hour contracts has increased by 104,000 to 801,000, according to the ONS in the last few minutes. So 104,000, that's the increase of workers on 0 hours contracts. The total now stands at 801,000. Coming up a little later on in the programme, 6 of the Hatton Garden robbers will be sentenced this morning for their parts in the biggest burglary in British legal history. We'll talk to a former armed robber who knew 2 of them during his time inside. Next, are antidepressants being handed out too readily to children and young people? Both the World Health Organization and the UK's 4 children's commissioners are expressing concern at a rise in the use of them. Research shows that there was a 54% increase between 2005 and 2012, despite concerns that some antidepressants can increase suicidal behaviour. Here's one young person's story.
I remember just telling them this is not working, and it just seemed just more medication. That'll make you better, but it clearly wasn't. The antidepressants don't really do much at all. They take away the lowness, but they don't take away the struggle of everyday life. When I was first prescribed antidepressants, I was 16. I was severely anorexic. I wasn't really told the side effects of the antidepressants, but the problem I found with them is I quickly got used to them. They do say that in the first month, suicidal thoughts are increased. I was very suicidal. The thoughts were constantly plaguing my mind, so I had to be prescribed like sleeping tablets, antipsychotics to try and dampen down those thoughts while I was getting used to the medication. I have a whiteboard on the back of my door which I have to write everything I have to do each day, such as things like washing, doing the tidying, taking my medication. I'd forget things. Since I've been prescribed, my short-term memory was shattered. That is one of the biggest impacts for me of the antidepressants. Fluoxetine, which I was on, it seems to be doled out to me like Smarties by doctors. I think it's just a quick fix thing to keep young people safe whilst they're waiting for therapy such as CBT or psychological therapies, because the waiting list is so long that there's nothing else they could do in the meantime. So to keep them safe, they keep them on medications such as antidepressants. When I did pick up the courage to go, this medication isn't working, I felt like I was talking to a brick wall. They're just like, let's just higher the dose. Well, the medication isn't working already. How is hiring a dose going to be? And if I did say something, it's just like I was shot down immediately.
Well, let's talk now to 20-year-old George Watkins, who has depression and has been on medication for it since he was a teenager. And also with us, Dr. Matt Piccaver, a GP, who says he tries to avoid prescribing antidepressants to young people. Welcome, both of you. George, first of all, take us back a few years. Tell us, talk to us about the time when you realised you weren't feeling good.
Good morning. It all really started when I was about 13. I started struggling with sort of the usual anxiety of being at school and really growing up, but it was getting out of hand. So I went to see my GP, And he put me on a small dosage of beta blockers first of all, which didn't really do much, and so I was upgraded onto a long release one.
What were they supposed to do?
Essentially, I think it's to do with the beta receptors in your heart, and the idea is that it slows, it chills you out basically.
Okay.
Makes you feel less inclined to really have a panic, and so a side effect that I felt of that was feeling incredibly sedated, to the point that I began to sort of feel like I was in a little world of my own almost, and it's terrifying, and I started to get really quite scary mood swings. And so I went back to see my GP, and I'd sort of explained what I was feeling, and he essentially recommended that I go on antidepressants, and I was quite excited at first, but it's because I guess it's a relief of knowing that there's sort of a potential solution to the problem, but it didn't really pan out that way.
What happened?
I've been on them for 5 years now, and about 6 months after I was on them, I had a full mental breakdown while I was at school in the middle of my GCSE preparation, and I didn't leave my house for 6 months, getting suicidal thoughts and moods, and lost a lot of friends, and it was possibly one of the worst times of my life. It's hard to tell if it was a direct cause, but I do cite the Prozac being there as definitely not helping.
Okay. And you continue to take antidepressants now, is that right?
I do, yes.
But what effect are they having on you now?
As a bit of context, when I came to university in September, my new GP essentially looked at my prescription and was quite shocked. He consulted with his colleagues, and they concluded that the combination of the beta blocker and the antidepressant was not doing me any good. And also, I was on an inhaler for seasonal asthma, and so the combination of that and a beta blocker could have been potentially fatal. And so, after about 6 weeks of withdrawal from the beta blockers, I'm only on the Prozac now, but I'm hoping for another maybe month or two of stability, and then I should be strong enough to come off it once and for good.
Okay, well that's good to hear. Let's bring in Dr. Matt Piccaver then. As a GP, when a teenager presents to you with feelings of anxiety or mood swings or lack of self-esteem, what sort of process do you go through before potentially prescribing antidepressants to a young person?
I think it's a really difficult situation sometimes because there are a lot of forces in play that may influence that person's feelings, be it difficulties at home or at school, bullying, whatever. Being a young person in the 21st century is really difficult. I look back to the 90s and feel it was simple by comparison. It's important to take a history, try and find out the context. I generally say I throw every service I can at my patient until I find something that sticks. And antidepressant medication is probably the last thing I'd go near in younger people such as these.
Why?
Well, the evidence base for them is pretty poor. 2002, 2003, Committee for Safety of Medicines advised us against the use of antidepressant medication in younger people, particularly a class of drug called the selective serotonin reuptake inhibitor, of which Prozac fluoxetine is one member, because of the slight but significant increased risk of suicidal thought. Now, the only drug that really is licensed or is used in the treatment of adolescent depression is fluoxetine. So sometimes when you've only got a spanner, that's what you use.
Yeah. And with the huge waiting lists and the length of time it takes for young people to see a counsellor, for example, perhaps you can understand why some GPs will not use antidepressants as a last resort, but something that they would reach for earlier.
So I've had a chat to a lot of my GP colleagues about this subject, and pretty much all of them say, just don't touch them. Don't touch them. Try and use anything else but...
Well, why have we seen this huge rise then in the last 7 years or so?
Well, particularly interesting, if you look back at the trends, there was a paper that showed a dip from 2002 when the guidance was issued and an increase from 2005, and I think this is what that paper's echoing. And I think the NICE guidance of 2005, the last time it was updated, said that in particular cases under specialist guidance that antidepressant usage is available.
Do you think GPs are following that guidance?
I will only ever prescribe a psychoactive medication to an adolescent or child under the guidance of a consultant psychiatrist, because
Right.
the challenge is getting one.
Yes.
And there are gaps in provision, lack of funding and things like that we see.
And apart from counselling and antidepressants, what else could young people, children do if they are experiencing anxiety and feelings of depression?
I tend to try and look for the root cause, because it's more, the pill is not a pill for life. And those depressive symptoms are symptoms of wider problems. So I tend to get social services involved. Are there issues about parenting? I get the schools on board, see what's happening inside the school area. I might get, might be used local charities that can help with people with mental health difficulties. The charitable sector often fills a gap that the NHS can't because of funding.
Have you got time to do all that?
No, but I make it.
Right.
It's my job.
Yeah.
That's why my wife never sees me.
Okay, fair enough. All right. George, you said you're hoping for a couple of months taking these drugs for a period of stability, and then hopefully you will be able to come off them. Do you approach that with optimism, or is it something that you're worried about?
To be honest, I feel like I've been through I feel like I've been pushed to my limits already, and I'm just relieved at the possibility to have that chance. I mean, I campaign on campus at the moment to get basically young people to have a voice with mental health, so to try and build up a more community support-based atmosphere at the universities themselves, so that we've got sort of a support service there alongside our official student support as almost like a well-being society. So I am very optimistic. I think there is a long way to go, but I think it's a good place to start bringing this up today.
I wish you all the best. Thank you very much for talking to us. Really appreciate your time. Thank you. And thank you too to Dr. Matt Piccaver. Right, you've been sending us your tributes for George Martin.